A variety of drug and drug combinations carry the risk of fatal overdose. However, in the case of opioids, which include heroin and prescription pain medications like Vicodin, Oxycontin, and Percocet, naloxone, also known as the brand name Narcan, can reverse an overdose, potentially saving someone's life. Narcan is an opioid antagonist used for the complete or partial reversal of opioid overdose. It has no known effects over people who are taking any opioid medications. Family members, caregivers, and other people who may have to use Narcan nasal spray in an opioid emergency should know the signs of opioid overdose and how to give Narcan before an opioid emergency happens. And after extensive research, I can tell you just how to identify the signs and how to properly administer this life-saving product. According to the Harm Reduction Coalition in the article Recognizing Opioid Overdose, sometimes it can be difficult to tell if a person is just very high or experiencing an actual overdose, especially if the person is using downers such as opioids or heroin. If someone is experiencing an overdose, these may be some signs: loss of consciousness, unresponsive to outside stimulus, awake but unable to talk. Breathing is very slow or shallow. For lighter skinned people, the skin tone turns bluish purple, and for darker people, it turns grayish or ashen. Choking sounds, vomiting, body is very limp, face is very pale or clammy, fingernails and lips turn blue or purplish black. If any of these things happen, it is important to react right away, even if you're not sure of the magnitude of this situation. If you suspect an overdose or someone is unresponsive, call 911. If you must leave the person alone to make the call, put them in the recovery position, which is on their side with the bottom of their arm underneath their head and their top leg crossed over the body. This is to avoid aspiration if he or she vomits. Narcan itself is available as a sterile solution for intravenous, intramuscular, and other administrations, but the nasal spray is easiest and just as effective as any other form. The process for administering the nasal spray is relatively simple. Do rescue breathing for a few quick breaths if he or she is not breathing. Affix the nasal atomizer to the needleless syringe and then assemble the glass cartridge of naloxone. Tilt the head back and spray half of the naloxone up one side of the nose. Here's shown here. If there's no breathing or breathing continues to be shallow, continue to perform rescue breathing for them while waiting for the naloxone to take effect. If there's no change in 3 to 5 minutes, administer another dose of naloxone and continue to breathe for them. If the person has labored breathing or not breathing at all, it is vital to conduct rescue breathing. Tilt the head back, pinch the nose closed, and give one slow breath every 5 seconds until the person resumes breathing on their own or until paramedics arrive. Once a person is breathing on their own, place them in the recovery position until paramedics arrive. Comfort the person as he or she may be confused. Opioid overdose is currently the leading cause of injury death in most states. Currently, there is a large opioid epidemic waving across the state of Arkansas, especially in the youth. It is in order to combat these things, naloxone rescue kits are becoming more readily available without a prescription in some drugstores in states nationwide. It is imperative to be prepared in certain situations. I hope that this was educational and you now know the proper way to administer the product that could potentially save someone's life.